Pleased to bring you today's speaker, Dr. Meir Lotan, physical therapist, author, researcher at the School of Health Sciences, Department of Physical Therapy at the Ariel University in Israel, and with the Israeli Rett Syndrome National Evaluation Team at the Edmund and Lily Safra Children's Hospital in Israel. Dr. Lotan has been working in the field for over 28 years. He has seen over 600 individuals with Rett syndrome. In addition to his publications and research, he works directly every week with 12 individuals diagnosed with Rett syndrome and has the added benefit of doing this therapy work with them in their homes, in their schools, and often in collaboration with other therapists, family members, and educators. We know we will all learn some things today and are eager to get started. So without further ado, Meir, if you are ready, I would like to turn the presentation over to you to get started.
Hi. Hi, everyone. Thank you for joining this webinar. And I will try to make it as interesting as possible, as well as very informative. There's one thing I forgot to tell you, Paige, and I think some of the listeners might be interested in, is that I'm initiating an international course entitled Physiotherapy for Rett Syndrome. And we're still in the process of evaluating the costs, but it will take place if there are enough participants at the end of January 2021. So be advised for further information about it. So I'll start the presentation. So this webinar today is focusing on walking in Rett syndrome, and I want to say thank you to International Rett Syndrome Foundation and Paige, and of course all the children and families with Rett syndrome that have agreed to be a part of this presentation. So today I'll start with some questions that have already been published, and then after answering them, we'll go directly to the presentation, which will discuss the reason for walking in Rett syndrome. Then I'm going to show you an intervention that I did, including treadmill training, talk about a research that have been done in Israel about losing and regaining walking in Rett syndrome, and then two case studies about two women with Rett syndrome on how to regain and enhance walking. One is an intensive program for one woman who has been in a wheelchair for 5 years, and the second one on how to use applied behavior analysis to enhance walking ability of a woman who can walk yet chooses to do as little movement as possible. So the first question is, does walking get more challenging as the child ages? Well, research done 2 years ago by a colleague of mine, Michelle from Denmark, has found out that 82% of girls with Rett syndrome live a sedentary lifestyle, and this percentage is increasing with the child aging. But I don't think it relates to the age of the child, but rather to the fact that girls who are older get less therapy and less chances of walking. So I think that girls with Rett syndrome do walk less when they age. Yet it is not about their age; it's about the support and the opportunities that they get, which are lessened with age. Another question that was asked by participants is, can girls with Rett syndrome learn to walk at any age? I can't generalize for all girls with Rett syndrome, but in my research projects across the world, and for instance in Ireland, we did a research project, and an 18-year-old girl with Rett syndrome who never walked independently in her life until that point started walking around. And we are now doing a research supported by International Rett Syndrome Foundation in Italy. And in this research, we had a girl at the age of 28 who needed support all the time and now has learned to walk independently. In another research in Italy, done 2 years ago, we have managed to get a girl at the age of 21 who has never walked independently to start walking independently. So I don't think I know that Dr. Baden is talking about a girl who learned to walk at the age of 16 through intensive hydrotherapy program. So I think that again, I'm not sure it can be generalized to all girls with Rett syndrome, but if you do intensive programs, then in some cases you can get girls who are not very young to start walking by themselves. Another question that I got from listeners to this webinar is, how can we encourage transitional movement practice more at school? Is it best to schedule movement times? I think that the whole concept of movement time is a bit distorted, because regular daily activities should be practiced ahead of time, so the girl is as active as possible. Okay, so you don't really need to plan movement times. You just need to get everyone around the girl, if it's parents, therapists, caregivers, everyone who is involved with the girl, to acknowledge the fact that movement for girls with Rett syndrome is actually, this is therapy. Okay, this is medication for girls with Rett syndrome. Movement is medication for girls with Rett syndrome. So the more they walk, the more they transfer from sitting to standing, the more they stand is best for them. So this is something that needs to be reminded all the time to all caregivers, as well as parents and everyone involved with the girl. So okay, let's talk about, sorry.
Meir, I'm sorry. Oh, there we go. I think we're
Yeah.
your slide.
Okay. The first question that we should ask is, why should children or girls or women with Rett syndrome should walk? And right. So the first thing is to improve cardiovascular fitness. Everybody knows that when you walk more, when you practice, you improve your cardiovascular fitness. Especially girls with Rett syndrome who needs to be at their best physical fitness to perform at their best of their functional abilities. And we know that girls with Rett syndrome prefer to live a sedentary lifestyle. They prefer, most of them prefer to be left alone and not to do a lot of exercise. So it is our duty as therapists, parents, caregivers, to get them all on their feet and walking as much as possible. We know that girls with Rett syndrome are prone to osteoporosis. Okay, so walking, standing and walking is a sure way to prevent osteoporosis, or at least to minimize it. So it's another reason why they should walk. And if we look at this graph, we can see that the pink line is describing bone strength of a girl without Rett syndrome, while the blue line is describing bone strength in girls with Rett syndrome. And we can see from this graph that girls with Rett syndrome, their bone strength is not developing in the way that it does with the normative girls. So therefore, we need to get them as active as possible to get their bone strength as strong as possible.
Mayor, I'm terribly sorry to interrupt, but I don't think that we're able to see your slides.
You're not able to see my slides?
No.
Okay. At what point did you lost me?
We've not seen your slides at all. We were only seeing you speak on your webcam. So. So let's see, I'm going to ask if everybody can see my slide right now. Mayor, can you see my slide that gives your name and yes?
Yeah.
Okay. I'm going to send control back to you. And try accepting permission again. There we go.
Okay.
Perfect. Perfect.
So in short, we're talking about why should children with Rett syndrome walk. Then I was mentioning the fact that improving cardiovascular fitness is very important for girls with Rett syndrome. Also, we were talking about the fact that girls with Rett syndrome are prone to osteoporosis. And if we look at this graph, we can see that the pink line describes development of bone strength of girls without Rett syndrome, which is the pink line, and the blue line describes development of bone strength over the years in girls with Rett syndrome. And we can see that the bone strength of girls with Rett syndrome does not develop as it should in normative population. Therefore, walking and standing as much as possible is mandatory for girls with Rett syndrome. If we look at this graph, for instance, on the left side, we can see girls who are wheelchair bound or wheelchair users or assisted walkers. And on the right side, we can see independent walkers. And we can see that bone strength of independent walker will actually walk much more than girls with assisted walking or girls in a wheelchair. Bone strength is better in those girls, suggesting that if they walk, their bone strength is improving. Constipation is also a comorbidity in Rett syndrome. And if we look at the reasons for constipation, we can see that there's all those points painted in red are typical of girls with Rett syndrome, and one of the most important one is lack of physical activity. Therefore, if we get the girls active, if we get them going, if we get them walking, then we can prevent at least some of the cases of constipation. Late motor deterioration is the fourth stage of Rett syndrome. It is mentioned in the literature yet by Hagberg, yet we're going to talk later in this presentation about the fact that I do not believe that stage 4 is mandatory for girls with Rett syndrome. I believe that actually it should be revoked, and that the stages of Rett syndrome should be regression, and post-regression without this 4th stage. And when we talk about the research that we did in Israel, I will explain why I think that this is the case, that Rett syndrome should only have 3 stages. Scoliosis has been is another comorbidity typical of many with Rett syndrome, and we know that there is a correction found between ambulation ability and specifically stair climbing and milder cases of scoliosis. If we look at surgical intervention in Rett syndrome, we know that 66% of non-ambulatory individuals with Rett syndrome undergo surgical intervention, while only 25 of ambulatory individuals with Rett syndrome undergo surgical intervention for scoliosis. Therefore, this is another reason why girls with Rett syndrome should be walking, why we should make them walking as much as possible. Another issue in Rett syndrome is vagal tone. We know that we have the autonomic system, and we know that it is comprised of the sympathetic and parasympathetic systems, and we know that in Rett syndrome the sympathetic system is overactive, and we also know that aerobic training is increasing cardiac autonomic control. Therefore, if we get the girls going, if they walk as much as possible, then their autonomic system will be more balanced, and therefore they might be even less anxious, and their sympathetic system will maybe they will be more calm. So you understand by now that we need to get them going. So I'm going to describe a program that we did. Now it's been, I think, 20 years ago. It's a treadmill program for individuals with Rett syndrome. So the question should be asked, why work with a treadmill? I mean, we can go out, we can take trips. This is true, yet in different countries we have different weather conditions. For instance, in Israel, 8 months in a year, it's very hot, and it's too hot to go outside because, and in other countries it might be too cold to go outside for many months in a year. Therefore, if you use a treadmill, you can do it in an air-conditioned environment. You can do it on a regular basis. We know that girls with Rett syndrome do not react very well to changes. So therefore, if we walk sometimes and then we don't have good weather condition and we stop walking and then we do it again and we restart the walking activity, then it might be difficult for the girl with Rett syndrome. But if we use a treadmill, then we can do it on a daily basis or at least a few times a week, and it becomes a habit for the girl, and it's easier for her to handle this program, and there are no changes. Another thing is that treadmills are actually quite cheap, and you can use one treadmill to train 5 or even 10 girls with Rett syndrome throughout the week. So with very low cost, you can train a lot of girls. Another thing about using the treadmill is the conditions can be controlled. You can control the time that the girl is walking on a treadmill, the distance that she's walking. You can see how many calories it takes, the inclination of the treadmill, and also the speed. And also, if you walk outside with a girl with Rett syndrome who shows severe difficulties in walking and needs a lot of assistance, then it will be difficult for the caregivers or the parents or the therapist to maintain this walking program for a long time. While on the other hand, if you use a treadmill and you use some supportive devices such as the one presented in this picture, then the girl can walk for longer times and longer distances and maintain her functional abilities and strengthen her muscles and improve her physical fitness. So in this research, 4 girls with Rett syndrome participated. They were ages between 7 and 11. All of them were at stage 3 or post-regression stage. They had a half an hour daily physical exercise for the duration of 2 months. Now, since girls with Rett syndrome are vary from one another, then we couldn't find 4 other girls who can be a control group. So what we did is we did 3 evaluations. We did evaluation 1, all the evaluation during all the evaluation, we measured pulse at rest, pulse during exercise, and functional ability. So we did observation 1, where we measured all those things that I mentioned. Then we did another observation after 2 months. And then after another 2 months, we did observation number 3. Yet within observation 2 and 3, we did the intervention, the daily walking for half an hour for 2 months. And this is how it looked like. Okay, the girl walking on the treadmill. We did some adaptations to the treadmill, but I'm not going to mention it now. But it was adapted to the girls' abilities, and they had help in holding the rails and stuff like that. And you can see in this graph describes the influence of the program on heart rate during exercise. And as I mentioned before, that we had 3 measurements: 1, 2-month observation 1, then observation 2, 2 months later, and then observation 3, 2 months afterwards. And in between observation 2 and 3, there was the intervention, daily walking intervention was applied. And you can see from the graph that there was no change in heart during exercise, but after walking for 2 months on a daily basis, we can see a impressive reduction in heart rate. This graph describes the influence of the program on heart rate at rest. I should say now that heart rate at rest is correlative with physical fitness. So when heart rate at rest reduces, it means that your physical fitness has improved. And again, we can see that there is no change between the first measurements, but between measurement 2 and 3, there is a significant reduction in heart rate, suggesting a significant improvement in physical fitness of all the participants. This graph describes the functional performance of the girls. Okay, this is girl number 1, number 2, 3, and 4. The pink line describes the baseline, observation 1, and we can see that between observation 1, the pink line, and observation 2, the blue line, we can see that there is some improvement because their regular physical therapy and rehabilitation treatment continued, but the difference between observation 2, the blue line, and 3, the yellow line, is very significant and can be seen in all girls. So we can see that there is a significant improvement after participating in this daily walking exercise program. If we look at some of the things that improved, here we see again the 4 girls, and what you're looking at is a change in knee walking after the 2-month program. And here we see 3 girls who have improved significantly after being involved in the program. This measurement looks at the speed of walking for 25 minutes, and again we see 2 girls, number 1 and 2, have improved significantly after being involved in this program. In this graph, we see their ability to descend stairs. Getting 12 points means that they walked 3 stairs in less than 2 minutes. Okay, and we can see that all 4 girls have improved their ability to descend stairs significantly, and this is ascending stairs. And again, we can see that 2 girls have improved their ability to ascend stairs due to this program. And may I remind you that when we talked about scoliosis a few minutes ago, one of the items that can predict the prognosis of scoliosis in Rett syndrome is the ability of the girls to walk up and down stairs with or without help. So it might be suggested that getting the girls walking on a treadmill improve their ability to walk up and down stairs, which might have a good effect on their scoliosis. This graph describes the connection between functional ability, which is the pink line, and their physical fitness or reduction in heart rate, which is the blue line. And we can see that there is a significant correlation between improvement of physical fitness and improvement in functional ability. So therefore, we can assume that if we get girls on a daily walking program, we improve their physical fitness, and this will cause improvement in the functional ability. The second research that I wanted to talk about was losing and regaining independent walking in girls with Rett syndrome. Rett syndrome is described in the literature as having 4 stages, with the 4th stage called late motor deterioration, which is the loss of ambulation after it has been acquired. Yet we can see in the literature 3 cases describing women with Rett syndrome who have regained walking after 5, 12, and even 23 years of wheelchair use, which is impressive. And also, as a clinician, as Paige mentioned at the beginning of the talk, I've been working with girls with Rett syndrome for over 30 years. During this time, I have seen few cases where girls with Rett syndrome have lost their ability to walk but regained it again after some time. And this whole research started as I'm one of the Israeli national evaluation team for girls with Rett syndrome. We go across Israel and we visit different settings such as schools and residential settings. And in one place where we visited, we saw a girl who was 16 years of age, and the headmaster of the school, who was probably trying to show her knowledge in Rett syndrome, have said to us that this girl is not receiving any physiotherapy because she's 16, so she's going to go into the 4th stage of Rett syndrome in a short while, so there's no point in giving her physiotherapy. Of course, we told her that this is not the case. Actually, I'm still seeing this girl on a weekly basis. She is now 30 years old. She is going up and down stairs. She walks. She can sit on the floor from a standing position and get back up to standing position from the floor by herself without any help. So this expecting the 4th stage is a very serious thing. And if people are expecting the 4th stage, then if a girl who they treat loses her walking ability, they might think that, okay, so she has reached her 4th stage and there is no point in doing anything because this is part of Rett syndrome. So this is the reason why we started this research, and the aim of the research was to evaluate episodes of losing independent walking and regaining it by individuals with Rett syndrome. We contacted all families of girls in Israel with independent walking ability. So at this time there were 154 diagnosed girls with Rett syndrome in the Rett syndrome Association. We took out 11 girls with HDKL5, 18 girls which the Rett syndrome observation team have not evaluated, so we didn't know their functional abilities. 15 girls were not approached because we didn't have valid contact details, and non-independent walkers were excluded. So we ended up with 49 girls who were able to walk independently. We called the parents and we asked them 5 questions. Did your child experience any episodes of inability to independently walk? At what age or ages did those episodes occur? What was the reason for such episodes? How long did those episodes last? And what was the reason independent walking was regained? We found out that episodes of losing independent walking was reported in 80% of the children. I have to mention now that when I presented this in Rome a few years ago, one of the remarks from the audience was that doing this kind of research, one of the faults of this research is the memory of the parents, because sometimes you forget events that have occurred if your child has lost her walking ability and then regained it. So actually, it might be that the percentage that I am reporting now, 80%, might be even higher. We found out that on average, almost two ambulation losses episodes occurred to each girl. So each girl actually experienced 2 episodes of loss of ambulation and regaining it again. Okay, if we look at the ages that losses of ambulation can occur, you can see on this graph that it can happen at any age. So you can't say that loss of ambulation is happening more at the younger age or older ages. It can happen at any age. And the duration of independent cessation, the mean walking cessation was found at 180 days. So actually the mean independent walking cessation is actually half a year in girls with Rett syndrome. If we look at this graph, you can see that, of course, most cases have lost their walking ability for less than a week, for only a few days. 11% for 1 week up to a month, 13% between 1 month and 6 months, and 11% more than 6 months who lost their walking ability for more than 6 months and regain it again. And most individuals regain walking ability spontaneously, yet those with longer duration regain their walking ability due to intensive walking program by the parents or the physiotherapist. The reason for losing independent walking, there are many reasons. It could be orthopedic, like broken leg or even a blister. It could be neurological. Mostly, it's mostly epilepsy. 9% of iatrogenic reasons, 11% emotional. I can describe one of those girls. She has a foreign worker who went home for a vacation for 2 months. The girl stopped walking, stopped eating, started sleeping throughout the day, and actually you can say that she was depressed. So and when the caregiver came back from her vacation, the girl regained her regular abilities and then was able to walk again. Sensory issues is something typical of girls during adolescence, and I'm going to describe to you one of these girls during in a few minutes in this presentation. I want to focus on one of the girls who had lost her walking ability due to physiological reasons. This girl used to cry a lot at school, and the caregivers found out that if they give her chocolate spread bread with chocolate spread on it, she is not shouting as much. So actually they just kept feeding her all the time. And when she got to 90 kilos, yeah, girl with Rett syndrome, 90 kilos, this is something that you don't see a lot. But when she got to 90 kilos, she was not able to walk anymore. Since the parents were quite old, they couldn't handle her, and she was moved to a residential facility. The physiotherapist at the facility thought that a girl at this weight is inconceivable. They started on a diet, and when she got to 60 kilos, she started walking again. So you see, there's a lot of causes that can cause a girl with Rett syndrome to stop being able to independently walk, but many of them can be handled. Okay, so again, I want to finalize this research and and say that losing and regaining independent walking is a common phenomenon in individuals with Rett syndrome. Actually, 80%, and as I mentioned before, it might even be higher. One very important thing is that in all episodes, parents knew the reason for cessation of independent ambulation. It is very important to mention this fact because we know that girls with Rett syndrome can't talk, and the fact that the parents were always aware of the reason is a very good point for the parents that are very aware of the child's condition and the situation that she's going through. But another thing to take note here is if your child is an adult living in a residential setting, she might lose her walking ability without the caregivers knowing why, and then they will relate it to the 4th stage of Rett syndrome. So therefore, if you have girls with Rett syndrome in a residential center, you should maybe be with your aware of her condition and things that are occurring with your child. And the most important thing I think is when a child with Rett syndrome loses her independent walking ability, it is important to diagnose the reason and initiate an intensive walking program. So if I've constructed this diagram that says that you assess the reason for losing the walking ability, then you see if the reason still exists. Is the child still weighs a lot of kilos? Is the child still suffers from ankle sprain or from the fracture? If she does, then suggest ways to overcome the difficulty. But if she does not suffer from this reason again, initiate an intensive rehabilitation program. We will use this diagram later in this presentation. But now I get to the other effect that I mentioned before about why I think that Rett syndrome should not be described with 4 stages, because we see the phenomenon of reduced function or reduced mobility is evident also in other individuals with disability during adolescence. We see it in people with cerebral palsy. We see it also in people with Down syndrome. And we see that their ability is reduced when they are becoming older. And on the other hand, we don't see any pathological element that can be detected in girls with Rett syndrome during adolescence. I mean, there's no specific difficulty that specifies girls with Rett syndrome. Therefore, I recommend to adopt a suggestion made by Lady Dr. Alison Kerr, and she suggested that there will only be 3 stages in Rett syndrome: pre-regression, regression, and post-regression. These are other questions that were raised before this presentation. For instance, one person asked if a child is 3.5 and is currently walking, is there a risk of her losing her ability to walk? Well, the prognosis in Rett syndrome is not always clear, and you can't assure that a child who walks will continue walking, and we know that some of them lose their ability to walk. But I think that if you maintain walking ability of girls with Rett syndrome, if you keep them as active as possible, I think that the chances increase that she will be able to maintain her walking ability and even improve it. Another question is, how often do you feel children should be working on walking on a daily basis? As I mentioned at the beginning of the talk, I think that walking for girls with Rett syndrome is like medication. They should do it as much as possible. I mean, it also it maintains their functional abilities, it maintains their muscle strength, it maintains their balance abilities. So I think that if you can have the time for a daily walking activity for a girl with Rett syndrome, this is the best. But if you can do it a few times a week, it is also good for the girl. As much as possible is better. Another question is, what is the best way to walk with them? Holding their hands, use a gait belt, or two-person assist? The thing about our princesses with Rett syndrome is that they like being supported. As I mentioned before, they don't like to work hard. So the more support you give them, they will try and lean on you and work as less as possible. I think that the best way to describe walking with Rett syndrome was mentioned by Dr. Ellison Kerr, who once said that walking with girls with Rett syndrome is being there without being there. It means that your hands, your presence should be aside the girl, giving her as little support as needed, giving her assurance that you are there to support her if something happens, but giving as little support as possible for the girl, because when the girl will get too much assistance, she will try to walk as little as possible. I can mention in a research that we did in Sicily, two of the parents came with the girl into the evaluation room, and they were holding her on both sides, and the girl was actually almost dragged into the room because she was leaning on the parents. And I saw that she had potential, and I was holding her pelvis with as little support as possible, and she was trying to lean on my hands all the time. And at the end of the session, we found out that she can actually walk independently, and we even built an obstacle course for her, which she walked through very successfully. So walking into the room with too much support made her lean on the parents and do almost nothing. The moment that this support was taken away, suddenly the girl ability to walk independently was obvious. And so again, being there without being there is the way to walk with girls with Rett syndrome, giving as little support as possible and making sure that she is doing as much as possible. So I'm going to describe two projects that we did now. Those two projects describe the way that you can regain or enhance walking in individuals with Rett syndrome. So the first project is about regaining walking ability in Rett syndrome. It's a case study about a girl who was born in 1980, so she's now in her 40s. She had a slow yet apparently normal development until the age of 1. And during her second year, development was halted and beginning of hand mannerism, which is very classical for girls with Rett syndrome. She started walking at the age of 2. And then if we look at her medical records, when she was at the year 2002, she was actually at the age of 22. It's written until 3 months ago, walking with support. Since then, an increase in spasticity leading to loss of walking ability. And a month later, does not stand, full loss of walking ability. So this is from the medical records, and I started working with her and saw her in this. When I came to work in this facility, I found her like this. She was sitting in this wheelchair with a very rigid muscle tone, and it was very hard to move her, and to move her. Even her hands were very, you can see that they are clasped and very strongly, very tightened. Maybe I'll stop this video and talk about it for a few minutes because I don't want to interfere with what you're about to see. So this is the girl sitting in this chair that we've built for her. I'm going to go over her and get her on her feet. And what you're going to see is that at the beginning, she's having a sensory problem. She's having a hard time getting accustomed to being in a new position. So when I move her from a sitting to a standing position, she will try to go back to the chair. She will try to lean backwards. At this point, if I leave her, she will fall backwards. And if I pull forward, which you're going to see, she will lean backwards even harder. So this means that what the doctor has written in the file is loss of walking ability is what happens to her at the beginning of getting her to a standing position. What I will do is I will wait holding her, and then after about half a minute, she gets accustomed to this new situation and she starts shifting weight from left to right, and then I can leave her alone and she can walk by herself. So getting her to a standing position should be done as slowly as possible, and getting her to be as active as possible in this process, so it's easier for her to get. So if I pull her forward, you see she gets back. She's trying to lean backwards. So if I leave her now, she will fall. So I just have to wait in this position until her sensory system gets used to this new position. When it does, she will start moving. There you see she starts moving from side to side, and now she can walk by herself. So now I can leave her. I'm holding her armpit just as a safety precaution, but she's doing the walking by herself. So how did she come to this position? Well, as I said, she had sensory issues. Her proprioceptive system was not clear to her. So when her position was changed, she got insecure and she was trying to get to her sitting position, back to her sitting position. The caregiver this time tried to pull her forward because she was leaning backwards, which only make things worse. And this what gotten her in a wheelchair. So I built a daily program which included independent walking with a walking frame. Okay, so the caregivers used to put her in this walking frame just to keep her in a standing position. Okay, and when she was standing in this standing frame, after a few minutes, she started walking around the facility and exploring the everything around. Another thing is we gradually reduced the use of a wheelchair. We did it by building 3 chairs like the one that you're seeing now. One was placed at the entrance to her room, one at the dining room at the residential facility where she was living, and the third one was placed at the day center where she was staying during the morning. So actually all her transfers from her room to the dining room, from the dining room to the car, from the car to the day center, from the car in the day center to the chair in the day center and back again, were done by walking instead of wheeling her in the wheelchair. She had a program of lying on her stomach every day because, as you saw, the first picture of that you saw of her was that she was very clenched in this flexed position. So we need to slowly get her to a more erect position. And also we had the staff guidance, and I instructed the caregivers to do weight shifts instead of pulling her forwards, okay, and not to put her in bin bags, because when it was easier for the caregivers to put her in the bin bag, and you see that in the bin bag immediately she goes into a clenched position, like tilting to the right with her scoliosis and flexing her arms. While sitting in the wheelchair, she is much more erect. And in physiotherapy sessions, I worked on her range of motion. I improved her equilibrium in standing and walking. I enhanced the walking ability and also started doing stair climbing and descending with her. So this is her first steps after 5 years in the wheelchair. And this is today, and you can see that she can she don't even need she doesn't need me to be around her when walking, because she can do it very safely and by herself. And you can see that she's walking for for distances, and she can go into the physiotherapy room by herself without even me telling her so. This is the beginning of going down the stairs. I had to do all the weight shifts and help her a lot. And now this is done much easier. Sorry, the presentation just collapsed. We'll go back to where we were in a minute. And this is her going down the stairs. At this point, you can see that she's doing most. She's supporting my chest with her hand, but basically she's doing and she's leaning on the rail, but she's doing everything by herself. And this is walking up the stairs. So again, if we look at the diagram that I described earlier, so we assess the reason for losing walking ability. Does the reason still exist? Yes, it does, because she's still having sensory issues. So I suggested ways to overcome the difficulty by telling the caregivers to instead by making more walking opportunities for her, and by taking her away from the wheelchair, and also by guiding the caregivers to do weight shifts instead of just pulling her when they wanted her to walk. So we assessed the reason, we built the 3 chairs, we removed the wheelchair, we gave her a lot of sensory feedback in standing and walking ability, we did a lot of walking with her. We improved the trunk and legs range of motion, which were reduced by sitting in the wheelchair for 5 years, and then the staff was instructed on how to handle her when walking. So we can see that an intensive program can reinitiate walking ability in some adults with Rett syndrome. I do not want to say that it can be done with everyone, but at least some girls with Rett syndrome can regain their lost walking ability. Another program that I would like to present is how to enhance walking through the use of applied behavior analysis in a girl with Rett syndrome. So we talked about the fact that walking is very important. It's a basic physical activity, and it has a lot of benefits for girls with Rett syndrome: to prevent osteoporosis, to improve joint range of motion, enhance muscle strength of the lower limbs, to improve pulmonary and cardiovascular function, reduce burden of caregivers. Of course, if the girl can walk by herself, then the caregivers are uh, not do not have to carry her, and then therefore they work much less. And also there is a social issue because a person with walking ability is perceived as less disabled by society. So what is applied behavior analysis? It is a science that involves using modern behavioral learning theory to modify behaviors, and the behavior analyst assesses the relationship between the target behavior and the environment. So I'm going to describe to you a girl who is 28 years of age. She lives in a community home. She is diagnosed with Rett and is able to walk independently. This is her walking without any problem. But you usually find her like in this position, sitting around and trying not to walk. So we did the ABA analysis and we found out that she likes to be stroked on the head. She likes to get verbal praise like, oh, very nice, you're walking very nicely, you're doing very good. And she likes to eat sweet things. But you can see that she's not very thin. So we decided not to use sweet things as a motivator for her. So we did the ABA pre-intervention evaluation. We did a pre-intervention baseline evaluation using a step counter, and then we did the intervention itself with ongoing measurement of the step count. What you see in this graph is sorry, two people. The purple part is my step counts for a duration of a week, and the red one is step count of this girl, of this woman, for a week. So my step count for a week is 1191 steps, while her step counts for a week are on average is 800 steps per day. And we know from the World Health Organization that in order for you to keep your health, you need to go for more than 10,000 steps a day. I'm mentioning here that Michelle from Denmark, Dr. Stolholt, found out similar results from her research in Denmark about the number of steps taken by girls with Rett syndrome on a daily basis. So we started the ABA program. So the reinforcers were verbal praise and gentle hair stroking. So every time I found her in a standing position, I went to her and told her that she's doing very nicely, that she's standing very nicely and walking very nicely, and stroked her hair. And she was very enthusiastic about it. And actually what happened is that when I was working in this place, she was actually walking around me all the time, so I can tell her how good she's doing. So she started walking much more. And also another part of the program was to control the environment, because she had Rett syndrome, she couldn't move the chairs when she wanted to sit down. But when anybody left the chair, you see this chair half away from the table, so she used to cramp in and sit on the chair. And if there were any bean bags, she would sit on them as well. So we took all the bean bags away, and we instructed the staff not to leave chairs like this that she would be able to sit in. And this is her walking ability, and you can see this learning graph. You can see that she's walking more and more. And if we look at her walking number of steps that she took before we started the intervention, and afterwards you can see that she started at 800 steps and ended up almost in 9,000 steps a day. So this is a huge difference for this girl, probably something that will keep her on her in good shape for many years. So we can conclude by saying that applied behavior analysis could be suitable for individuals with Rett syndrome actively avoiding participation. So to finalize this presentation, I would like to give some take-home messages by saying that walking is extremely important for anyone, but especially for girls with Rett syndrome. That it is important to get girls with Rett syndrome walking from a young age. It could be in nature, it could be if a girl likes to go for shopping, then going for walks in malls is another solution, as long as the girl is happy. And treadmill training is also a possibility. We also know now that losing walking abilities does not mean that the child has gotten into her fourth stage, and instead of giving up, we should actually implement an intensive walking program. In some cases, it might be possible to regain walking ability of individuals with Rett syndrome who have lost this ability. And as I mentioned at the beginning of the talk, we have regained walking ability of girls who have sat in a wheelchair for 12 and even 23 years and 5 years, and even girls who were not able to walk independently at the age of 21 and 28 and 16 were able to improve their ability and regain lost abilities. When walking is lost, find the reason, solve it, and apply an intensive walking program for the girl. In some cases, it might be possible to enhance walking through numerous ways. For instance, treadmill, for instance, a daily walking program, and even through applied behavior analysis. It depends on the girl and the reasons why she is not walking a lot or why she's not walking at all. And if you solve those problems, you can get the girls to walk more. Some girls do not like to walk, so you need to find good motivational factors for them. For instance, walking to watch a video, walking to see friends who live near your resident or near your house, going to visit family members who live near the house, or walking with the dog, and other motivational factors, each adapted to the specific girl that you want to implement the program with. It's important to join walking activity with a functional gain and not just train. This is it actually goes back to one of the things that one of the questions that were presented at the beginning of the talk, if walking should be practiced or transition should be practiced. If you attach a functional gain to the walking, then it's not a training anymore. If you, let's say, if you live in a third floor and you have an elevator, then you can go out the elevator on the second floor and do every day, go down one floor through the stairs and then take the elevator. And when you go back home, you go out on the second floor and you go up a stair to your home. Okay, if the girl if the girl likes to see children, then you can go to the park and watch children playing in the park. If she likes horses or dogs or cats, then you can go and visit the neighbor with the cats or the neighbor with the dog. So you can then walking changes from an activity that she doesn't want to do to an activity that gets her things that she likes, and therefore walking gradually becomes something that she wants to do. And that's actually the end of the conversation, and we can go on to further questions.
Meir, thank you so much. I greatly appreciate your presentation. I enjoy seeing the video. Your stories are so encouraging. We have a lot of questions that have come into the queue. We're doing very well on time, but let's see if we can answer some more questions that have come from people. And I would like to remind everyone that if you do have a question that you would like to ask Dr. Lotan while we have him, feel free to type it into the chat function and we will try to get to it today. If not, we will work with Dr. Lotan to develop a QA document to post to the website. Okay, so Meir, I don't know if you would like me to read the question or if you can see that I passed a question over to you in the question queue.
What is vagal tone? The question was, what is vagal tone?
Yes.
The vagal tone is part of the autonomic system, and it is divided into the sympathetic and parasympathetic systems. And when you have and it's supposed, those two systems are supposed to be balanced. When they are not, for instance, in the case of Rett syndrome, where you have a low functioning parasympathetic system, it means that the child is always more anxious, always irritated, like because this is what the sympathetic system is also referred to as the fight and flight system. Okay, it's the system that makes you ready to battle all kinds of dangers and uncertain situations. So if, and we know that many girls are agitated or kind of unrelaxed. Okay, so therefore, if we can balance this system, then we can get a girl who is more relaxed and more and less agitated, and therefore it's best for her. It's best for all of us to function with a balanced system.
Okay. Thank you. I hope that answers the question. There's another question in the queue that I sent your way.
I'm looking for it. Okay.
I'll read it. My daughter is 23 years old. She's 5 feet 4 inches tall. She was walking until 20 when dystonia and dyskinesia caused her to lie in bed all the time. She got very stiff and her Achilles tendons shortened. She is now on Artane and we gave her Botox. What else can we do to help her walk again?
I will read it now. Now I found a way to see the whole question. So give me a minute.
Okay.
I think it's kind of difficult for me to answer this question without really seeing the girl, because I don't get. It's a very the description is very there's a lot of details, but I still, you know, it's very difficult for me to get the whole concept. Maybe this question can be, maybe the parents who asked this question can send me videos or pictures of the girl, and I can answer them more specifically if I can actually see the girl in my with my eyes and get the full situation, get more details.
Okay, thank you for offering that. And to the parent who asked that question, if you would like to send that information to me, I will be happy to introduce you to Dr. Lotan and allow you to have a conversation directly. I know some of these things are very specific to an individual child. I just sent another question to you, which I think is more general and could be common to some families.
Are there exercises to do at home? This question?
No, here, let me read this one to you. Is there anything like too much walking for a girl with Rett syndrome? I help my daughter walk out in the community, but many people think that she gets too tired and they don't want me to walk her so much.
Well, this is something very individual to all girls with Rett syndrome. So I think that probably as a mother, you know your girl with Rett syndrome. You know that some of them or do not like to work hard and do not like to walk a lot. So I would suggest that you find a way to get some motivational factors in the walking activity. For instance, uh, maybe taking the dog out for a walk, maybe taking the dog out for a walk with phone on the back of the dog with YouTube videos that she might like, and then she will walk behind the dog and will be much happier. Or maybe do if it's something that comes up a lot, maybe she will have regular stop points on the way, like walking to the like let's say every two benches you sit down and you watch a video, and when the video is finished, like a song or something that takes 2 or 3 minutes, and then when the song is finished you go to the another two benches and you sit down and see another video. And this is how you can make it more motivational for her to be active, because she knows that whenever she walks a certain distance, I mentioned two benches, but it could be much more. I don't know what she's able to do, but she knows that the next stop she's going to see something that she likes. So it might be helpful for her to know that she gets something that she likes at the end of each walking session or something.
Yeah, I think those are all very good ideas. I think that the girl is willing to walk. I think her mother enjoys walking with her. I think what the mother is asking is that perhaps her partner, her spouse, maybe the grandparents think that she is pushing her daughter too much. And perhaps I could answer by recommending that they have those people watch this recording to see the benefits, scientific evidence benefits.
Yeah, I may repeat again the fact that I see walking in Rett syndrome as medication. I mean, it helps so many issues in Rett syndrome that it has to be done as much as possible for the girl. And if the girl enjoys walking and there's no problem in that, then yeah, they can see the presentation. And also I think that in some cases when I go into, caregivers are very good people by nature because they want to take care of others, but sometimes they are so good-hearted that they are saying let's get the woman or the girl to rest because she's it's so difficult for her. But I think that this is very wrong, and it's a concept that is not good for girls with Rett syndrome. they like to rest a lot, and it's not in their best interest to be inactive. So it is our duty as people who understand the importance of walking in Rett syndrome to convey this issue and these facts to others who might not know them, or feel pity for the girl for her efforts. I think it's beneficial for all girls with Rett syndrome.
Thank you. I think that's an important point to emphasize. The next question in the queue comes from a family who I think does not have stairs in their house. And the question is, does using a step stool, step up, step down on a step stool, have the same effect as stair climbing? Do you know?
I think that, well, I think that again, if you do a specific exercise, then it will not be implemented as much as you actually insert something into your daily activity. I mean, practicing going up and down steps will probably be done, I don't know, like 20 times. But if you actually insert steps into your daily routines, then you actually do it much more. So if you don't have steps in your home, maybe you can go into the mall and you not use the elevator, and then you go up the stairs and you get to the ice cream parlor and you get an ice cream cone, and you're enjoying your day together and enjoying the mall surrounding and people. We know that girls with Rett syndrome usually like other people, so you might change your daily routine so stairs will become part of the day, of course, with some kind of motivational factor inside. Maybe she has stairs at school that they can practice, so you adapt. So if you have stairs in school, then she can do the stairs at school, and at home you can just go for walks, or vice versa. So you find areas in your days and places in your daily schedules that can be used. This is usually in another talk that I give about Rett syndrome. I talk about the therapeutic environment, okay, and the fact that every part of the day of the girl with Rett syndrome, or actually any patient for that matter, can be used as therapeutic. I mean, you can give the child food in her mouth, but you can actually get her to work on every spoon that she gets in. Okay, you can get the girl in the elevator, but you can walk up and down the stairs. You can help her to walk or minimize the walking, so she has a good life, but you can actually see opportunities where walking can be done and can be implemented on a daily basis. So you need to think of how I can make everything in my daughter's life or my client's life as active as possible. You just find your own way to make her as active as possible.
Wonderful. Thank you. Okay, Meir, there's a few other questions that have come in that are very typical with girls with Rett syndrome that families would like some comments on. One is girls who walk on their toes. And do you have feelings or research or evidence that it's fine if that's how they prefer to walk, let them walk, walking is most important, or should intervention happen to get them to walk flat-footed?
Walking on their toes is something that is, on the one hand, it is good for the girl because she's practicing her balance abilities. On the other hand, if she's doing it too much or all the time, she might get her Achilles tendon too shortened and then might lose her ability to walk. So the way we actually we have, I think in the research that we're doing now in Italy, we have about 4 girls who are toe walking, and we found out that if we use something that is called Boxia, this Boxia is one of the names of this gadget. The original name is Dictus. Dictus is a gadget or a, a device that was invented by a Swedish tailor who had a drop foot. Every time when he was walking, his foot was pointing down towards the ground, so he used to fall a lot. It's something that happens mostly after a stroke. But the thing is that this is kind of a maybe I can show it to you on the screen. Can you see it now?
Yes. Yeah, we can see a Google search with different.
Yeah. So this is this one. This is the Boxia, okay, or Dictus. And it's actually it's wrapped around your ankle, and you have 2 rubber bands coming from the front of the shoe and up again. So it's a constant pull of the front of the foot towards upwards. And we found out that it can get girls with Rett syndrome to stop walking on their toes, and it keeps them actually, if they none of the girls in the research have complained about using this, and they're actually kind of so basically it's kind of a very cheap device. You can see I didn't meant to, but it says here that it's around 75 euros. So you can buy it, you put it on your child's shoes, and then she just stops walking on her toes. This is a good way to prevent toe walking. And to prevent the shortening of the Achilles tendon and the need for surgery to elongate the shortened muscle. Okay.
Okay.
Another
Thank you.
question? Yeah.
There was another question about walking in the swimming pool and the use of using water and aquatherapy.
Yeah.
Can you talk about that?
Yeah, hydrotherapy is a very nice intervention for girls with Rett syndrome. Most of them like the water very much, and they like doing water activities. And walking in the water is it's a very nice option for girls who can't walk on land. You should know that because of the hydrostatic pressure, the girl is surrounded by the water, and she can stay erect. But on the other hand, walking in the water is not good for osteoporosis because there's no pressure on the bone. So if you're battling osteoporosis, then walking in the water is less preferred. But again, if you have a girl who is having a very hard time walking on land, then walking in the water is a very nice possibility. And actually, as I said in the beginning, Baden is mentioning a case study of a girl who started walking after an intensive hydrotherapy program at the age of 16. So it is a nice way of getting girls with Rett syndrome to walk.
Very nice, thank you. Okay, I have another question. There was a parent who was asking if you can explain what weight shifting means. You used the term weight shifting in your presentation, and I don't understand what it means.
We watched the girl with the sensory issues and the fact that she had a hard time being moved. The moment you try to pull her forward, she immediately tried to lean backwards against the forward pull. So the thing is that if I hold the child's hand and I kind of sway her body from left to right, instead of pulling her forward, I just move her from side to side. Then for this girl, it was easier for her to start walking when she was moved from side to side rather than being pulled forward. Weight shifts meaning moving the weight from one leg to the other. We actually do this when we actually do it automatically when we walk, because one leg is, when we walk, one of our leg is in the air, and then we step on one leg, then we move the weight to the leg that was in the air, and now she's on the ground, and then the other leg comes up in the air. So this is weight shift is one of the elements of regular walking. But in this girl that we saw in the video, I had to induce weight shifts for her to walk more easily.
Okay, thank you. Thank you so much.
Okay.
We are nearing the end of our 90 minutes of time, and I want to be respectful for those who are maybe late at night or you're in your work day. I think we answered all of the questions in the queue that have a general application to the majority of our audience. I will export all of the questions that have been asked and send them to you, Meir, and we can work on deciding if you would like to talk to that parent individually about their child. Okay, because I think some of
I will be. Thank you for joining the conversation. I will be happy to answer all the questions that you will give to Paige, and she will transfer to me. And if you have any other questions, then feel free to write to me, or and I will try to help as much as I can.
Okay, thank you very much. I don't know if everyone can see my screen, but I just have a few closing remarks, which is one, I have to show my favorite picture, which is from Dr. Andreas Rett's archives showing a girl walking in 1937. And so my message to you and to all caregivers, trust your instincts, get outside with your girls. We've been doing this for a long time without the evidence, but we really appreciate the research that you have put in to documenting the benefits of walking in Rett syndrome. And I am really impressed with the numbers of girls who, if we don't give up on them, can walk. For those of you who would like to learn more information, here's the book that is published by Dr. Lotan, and you can access that book, I believe, through Amazon or other online sources. And he has a new book coming soon. The title will be The Time Is Now, Motor and Sensory Intervention in Rett Syndrome. It is currently written in Hebrew, and I know he's going to be working on having that book translated. Meir, would you like to make any comments about this literature and how people can use your books?
I think that Rett syndrome therapeutic intervention is a book that describes different aspects of Rett syndrome, like speech therapy, occupational therapy, physiotherapy, hydrotherapy. It describes different intervention approaches, and the new book is going to be very focused on physio and occupational therapy interventions suitable for girls with Rett syndrome. So it's a different book. It's a completely different book. It's not just a renewal of the previous one.
Very good. Thank you. Thank you. And I really look forward to having that book. I know that I've read the Rett syndrome therapeutic interventions cover to cover, and I know many therapists have benefited from having this publication available to them. So as a reminder, this webcast is recorded. You will be receiving a link to the recording within a day or two. We encourage you, and you are welcome, free of charge, to share this information to everyone working with your child. If you'd like to go online and purchase this book, it covers many aspects of therapeutic interventions, and we look forward to your book coming soon. Thank you so much, Meir. We appreciate all of your work, and we wish you much success in your future work.
Thank you, Paige. Thank you.
Okay, and closing for our audience, I have just a few more comments to make about research. It is a critical path forward in all of our domains, whether it's education, communication, quality of life, therapies, gene therapy, transformative treatments. All of the evidence that Dr. Lotan has been able to do has come directly from families being willing to participate in research. So in addition to your fundraising efforts, we ask you to please participate in research opportunities as they become available to you. Many are open in the US, many are opening in countries around the world. Right now, there's an online survey called the Voices of Rett. It will close in 3 days, March 13th in the US, and we encourage everyone to please go online and complete this survey if you can. In the US, you will be compensated for your time. If you email bgibson@rettsyndrome.org, you can see that on your screen. You can take advantage of that. The study also opened recently in the UK, Germany, Italy, and Australia. So you can visit your association website to find links to that survey so that we truly, the sponsor has a global participation. And they also adjusted the burden of illness survey to allow parents of boys with Rett syndrome to respond to the survey. So that is good news, and we appreciate them including all of our children in the study, young and old, boys and girls. Okay, so in conclusion, I'd like to remind everyone that we are committed to additional education programs in 2020 in the US. We will have monthly RettEd webcasts, such as this one. They are live, online, no fee. All of them are recorded and posted to our website in the form of a library that's publicly available. Our next RettEd webcast is April 23rd, which is a Thursday. It'll be at 1 p.m. Eastern, New York time, featuring Dr. Pam Diener. She's going to talk about what's going right in her brain and how we can maximize neuroplasticity in therapies. That is a fascinating presentation. It will play very well after hearing Dr. Lotan's presentation today, so I encourage everybody to go online and register for that. Monitoring the coronavirus and COVID-19 situation very closely, we at this point in time remain committed to our RettEd days, and we will adjust accordingly, as we monitor the situation. But as of right now, we have an Ed Day coming up June 6th at the Kennedy Krieger Institute of Baltimore, Maryland. Registration is open. We hope to see you there. Next one will be in Vancouver, Washington, right outside of Portland, Oregon on August 15th. We'll be in Greenville, South Carolina, September 19th, and Chicago, Illinois on October 10th. I also want to encourage all families to come attend the Rett Getaway with us in San Diego, June 18 through 21. It really will be an excellent opportunity to get together and do some adapted surfing. We are partnering with the Kayla Mosca Foundation, Surfing Madonna, and Surf and Fire to enable every child with Rett syndrome to have a chance to try adapted surfing at no charge. All families are encouraged to come together. There's lots of things to do in Southern California. We have a day out in Legoland. Disneyland is not far away. It's really an opportunity for you to grow as a family, to learn that vacations are possible, to allow parents, grandparents, siblings, and of course your child with Rett syndrome to make new friends for life. So please visit our websites, stay involved. We appreciate you, and we've covered a lot today. Thank you for being with us. Until we meet again next month, be well. Keep trying hard at walking and movement, and know that we care deeply about you at rettsyndrome.org. Thank you for your time, and we'll talk to you next month.